Hello, and welcome to Mindful Nutrinet, your go-to podcast for nutrition knowledge and mindful living. I'm your host, Nella Livelight, ready to take you on another deep dive into the fascinating world of nutrition and health. Today, we are exploring a topic that might surprise you, and that is stomach acid. Well, despite its often negative reputation, stomach acid plays a crucial role in our overall health. From breaking down our food to defending our bodies against harmful bacteria, its importance cannot be overstated. However, like all things in life, balance is the key. Both low and high stomach acid levels can lead to health issues, each with their own unique set of causes and symptoms. In this episode, we'll dive deep into understanding stomach acid, what it is, why it's so important, and how to identify and manage both low and high stomach acid conditions. I'll also share some of my personal experiences dealing with stomach issues, offering a first-hand perspective on this complex topic. So, get comfortable and prepare for a journey into the fascinating world of our digestive health. Before we begin, I want to say how over the moon grateful and thrilled I am about the feedback I received after my inaugural episode last week. I truly feel so deeply connected to my bath right now. I know it's 100% my bath and that it is how it's supposed to be. Honestly, the past 21 years have been quite challenging, especially the past 9-10 months or so, but I am beyond grateful for all my experiences, as those have led me to this point where I'm able to connect to myself and the world in a whole new different level. And I couldn't be more grateful for my tribe. You know who you are, and I know that you're listening, so much love to you all. Okay, that's that. We'll dive into more spiritual topics in the next episodes, as there's so much I need to get out of my system. But for today's topic, I felt guided to choose stomach acid. It all relates to what I've been going through in the past 9-10 months, and I just need this information out there so that less people suffer from things that are totally preventable and in most cases curable as well. I think there must be a reason why I've suffered so much, learned from it tremendously, and then started to send all this wisdom, I hope so at least, to all those who are open to receive. So, what about hydrochloric acid, aka stomach acid? Why is it so important? First and foremost, it is the key digestive acid produced by parietal cells of your stomach, basically cells in your stomach lining. Let's mention right away that the digestive tract and how it's functioning may be the single most important component that determines whether you're healthy or have a disease. By the way, can you guess how much food is digested throughout an average lifetime? Well, I would have never guessed it right. It's more than 10,400 kilograms, that's 23,000 pounds. Imagine that. No wonder you need to have digestive tract in order. Today, I won't walk you through the entire GI tract, but rather concentrate on the role of hydrochloric acid. Just briefly, let me say that there are 4 major functions of digestive system: ingestion of food via the mouth, then digestion, absorption, and finally elimination. Maintaining those functions at an optimal level is crucial. And when they are faulty, you most probably experience all kinds of dysfunctions that contribute to so many other problems. Besides the optimal functioning of the main characters of the digestive system, the stomach, the small intestine, pancreas, liver, gallbladder, and large intestine, there are other important factors that have a huge impact, such as emotions, stress level, and balance within the endocrine, aka hormonal, and nervous systems. So what happens in the stomach? It is the ultimate food blender, so to speak. It mixes and breaks the food, or the bolus. This is how the chewed mass that you swallow is called, given that you really do give it a good chew. So in the stomach, it's broken down into smaller bits. Now, chewing is so important because the digestion of carbohydrates begins in the mouth. Your salivary glands secrete the enzyme called amylase that does its magic even before you swallow. And it doesn't end there. Chewing also stimulates more secretion of saliva and stomach juices, thus creating a better ground for digestion. So, if you gobble your food down too fast, the digestion of carbohydrates remains incomplete and you may experience digestive discomfort and the nutrients won't assimilate as well. So, how does the stomach do what it does? It has the help of gastric juices that contain enzymes and voila, hydrochloric acid. What exactly is the role of this acid then? First, together with enzyme pepsin, it helps digest proteins. For example, many people have trouble digesting nuts because of their high fat content, which is even worse after roasting them in oil. So, proteins are first broken down in the stomach into peptides or amino acid chains. This happens with the help of hydrochloric acid, pepsin, and proteases. By the way, it's only been the recent years when it became clear that lack of stomach acid could compromise the entire protein digestion process. If there's low hydrochloric acid, the protein structure fails to open, and therefore the enzymes can't access the amino acids in the protein chains. Moving on, the next crucial task for the acid is to combat harmful bacteria, yeasts, viruses, and parasites. In other words, it boosts your immune system, helping fight all those pathogens that enter your body through mouth. Let's follow the food. Remember, when the chewed food entered the stomach, it became bolus. Now, in the stomach, and by the processes happening there, it becomes a mass called the chyme, and it moves to the first part of small intestine, duodenum. In order to make that happen correctly, we again need adequate levels of stomach acid. Now, hydrochloric acid goes beyond stomach and its functions, meaning adequate levels of the acids signal pancreas to secrete its secretions that contain the majority of enzymes that actively break down foods. And furthermore, stomach acid is also required for the absorption of certain micronutrients, specifically minerals such as calcium, magnesium, zinc, copper, iron, selenium, and boron. Finally, there's this super useful valve between esophagus and stomach called the lower esophageal sphincter, aka LES or LES. Now, hydrochloric acid signals this valve to close tightly so that the acid couldn't travel back up. When there's not enough acid, the little acid that is enters the esophagus and causes damage. So, a healthy amount of stomach acid keeps the lower esophageal sphincter muscle tight, preventing the acid from refluxing. This is often misinterpreted. People tend to think that too much stomach acid causes heartburn, which can be the case as well, but very often it's the opposite. Now let's recap the role of hydrochloric acid real quick. First, it is required for the digestion of proteins. Then it stimulates the pancreas, which stimulates the gallbladder and small intestine to produce the digestive enzymes and bile necessary for further breakdown of carbohydrates, proteins, and fats. It is important for the valve between esophagus and stomach to close tightly. It is required for the stomach to empty correctly into the first part of small intestine. Then acid sterilizes the stomach and kills bacteria and yeast that may be ingested. And finally, an acid environment is necessary for the absorption of certain micronutrients. Now that we know why proper acidity of a stomach is so important, let's talk about what affects the reduction of hydrochloric acid. I think it goes without saying that if your system is healthy, it does not need additional support, for example in the form of supplements or medications. However, In the United States and presumably in other developed areas of the world, the lack of stomach acid, a condition called 𝐀𝐟𝐼𝐥𝐢𝐴, is a common problem. What causes low stomach acid then? First, research shows that the natural level of hydrochloric acid and digestive enzymes decrease as we age. So the simple fact that you are growing older might be the factor, particularly after the age of 60. Later we'll talk about what you can do about it, but for now let's keep exploring the causes. Besides aging, there are other factors, of course. There are numerous ways one can abuse his or her GI tract and whole body through things like food excesses, chemical use and stress, which in turn affects the production of hydrochloric acid. Let's tackle stress first. What does stress do to a digestive system? Well, chronic stress hampers stomach's ability to produce enough hydrochloric acid and other digestive juices. When you're stressed, you go into flight or flight mode, that is, you activate your sympathetic nervous system instead of rest and digest, aka parasympathetic nervous system. Occasionally, people have increased hydrochloric acid secretion with acute stress, but usually over time chronic stress causes hydrochloric production to decrease. So initially stress increases stomach hydrochloric acid production. However, when you have increased acid levels, the pancreas is stimulated to release alkaline enzymes to help balance the acidity. And that's the reason why chronic stress can lead to hypochlorhydria, low stomach acid, and reduced function of the pancreas. This in turn may result in poor digestion and assimilation of nutrients, and thus vitamin and mineral deficiencies. Furthermore, you can develop food reactions because of the improper breakdown of the bulk foodstuffs. Subsequently, you'd absorb larger molecules, which may be immunogenic and cause reactions. Stress also puts a burden on the immune system and can lead to more infections, which in turn can mean allergies, both environmental and food allergies. For example, parasitic intestinal infections may act as direct allergens and also increase other allergic responses. In addition, emotional and mental stress, anxiety and fatigue, and even hormonal changes all increase susceptibility to allergies. I'm an excellent example to illustrate what stress can do to you. Without even realizing it, I've been suffering from low-grade stress, well, maybe at times not that low-grade at all, for a really long period of time, and finally 10 months or so ago, my stomach couldn't handle it anymore. Despite the fact that I have super healthy lifestyle habits, that is no smoking, no alcohol, whole foods and movement. Now that I really work on reducing my stress levels, I can finally see changes for the better though. So it's crucial to tackle your stressors and deal with them. Now that I mentioned it, I suggest you go back to my previous episode about the benefits of humming and chanting and sing a mantra with me. You'll see that this simple thing can already change things tremendously. Moving on to the next factor that affects low stomach acid, and that's eating habits. I'm not talking about food itself at the moment, but rather addressing eating too often, too much, and too quickly. As you might guess, acid production decreases when we eat more frequently than required by the body or when we overconsume food. In fact, when I observe people, I see that eating too quickly seems to be a common theme. Very often the food is being gulped down without giving it a good chew. Well, I see it in my home. Too often. Now, if you don't chew enough, it causes the body to generate even more stress hormones and you are in the loop. This in turn obstructs the production of stomach acid, causing indigestion. And we already talked about the salivary enzyme amylase that starts to digest carbohydrates in the mouth. So, most people skip the first part of digestion. I'm no saint here. I've had and most probably will have again periods of time when I'm snacking too often and thus not leaving enough time between meals. It means that the digestive tract can't empty completely and can't do its job properly. I definitely have digestive ailments when that happens, and I feel noticeably better when leaving 3 to 4, even 5 hours between meals. It's funny, when writing this script, I was munching on my homemade chocolate without realizing how much I had eaten, and the outcome was not pleasant, feeling uncomfortably full and as if there was a stone in my stomach. But instead of beating myself up, which I would have done before I started tackling my stress issues, I take it as a learning curve. Learning to understand the signals that my body sends out to me, trying to put some sense into my head. So that was eating habits, but a poor diet itself is an important factor as well. Especially a diet rich in refined sugars and refined grains, trans fats and chemicals, and low in fiber. This type of diet causes inflammation and therefore again results in elevated stress hormone levels. What's more, food sensitivities by themselves can cause stress in the body. So if you have any sensitivities, the common ones being gluten, dairy, corn, soy and peanuts, it's wise to keep those out of the menu for a while until your system stabilizes. If you keep consuming those foods, it can lead to further depletion of stomach acid. Next contributor to lessen stomach acidity is drinking at a wrong time. What does that mean? Although we all need to keep ourselves hydrated to remain healthy, drinking large amounts of water along with meals does not seem to work well for most people. The reason is that it dilutes the digestive juices and makes food breakdown more difficult. So, drink water between meals. Some water or herbal tea, about 100 milliliters, is fine though. And last but not least, there's the issue of overuse of medications such as over-the-counter antacids, as well as antibiotics and common painkillers. Antacids neutralize stomach acid and make digestion worse. So, when a person with already low stomach acid is treated with antacids because he or she may experience heartburn, which is caused by malfunctioning lower esophageal sphincter, and not by too much acidity, low stomach acid is aggravated even further. When antacids are taken for an occasional heartburn, it may offer short-term relief, but a long-term use often develops dependence. Even if low stomach acid was not a problem initially, when you take strong acid blockers, you block the natural production of hydrochloric acid, leading to all kinds of ailments and problems. So what about antibiotics and common painkillers? They disturb our microbiome and cause inflammation and indigestion among other issues. When taken often, medications such as aspirin, acetylsalicylic acid or ibuprofen can wear down our stomach lining and reduce the formation of hydrochloric acid. Now, let's recap the factors that contribute to low stomach acid. First, simply getting older, then chronic stress, poor diet and poor eating habits, drinking too much liquids with meals, and finally overuse of antibiotics, common painkillers, and over-the-counter antacids. By now, you must be wondering whether you have low stomach acid, right? How can you know? Well, the main symptoms, to name a few, are gas, bloating, belching, and discomfort after rich meals, but also heartburn, diarrhea or constipation, undigested food in stools, acne, rectal itching, chronic candidiasis, dry skin, cracked fingernails, fatigue, and mineral deficiencies. Now, I've already mentioned what the effects of having low stomach acid are, but there are a few things I want to emphasize. good digestive function is important to properly assimilate nutrients. And as mentioned in the beginning, hydrochloric acid is the key digestive acid. So without it, things go sideways. In fact, it all begins with good teeth. And teeth are made up of minerals, which are not well absorbed when there is low stomach acid and pancreatic digestive enzyme function. Let's talk about those minerals for a bit. Poor iron absorption and consequent iron deficiency anemia is one problem. The second one is osteoporosis that in part results from decreased calcium absorption. Both are affected by low stomach acid levels. Zinc and magnesium are worth mentioning as well. Next, general allergies and specifically food allergies are associated with low hydrochloric acid. And in turn, poor food breakdown and the leaky gut syndrome are associated with food allergies. I need to mention vitamin B12. In order to absorb B12, we need an intrinsic factor, cobalamin binding intrinsic factor to be more precise, also known as gastric intrinsic factor, which is a glycoprotein produced by the stomach in the same parietal cells that produce hydrochloric acid. So, if those cells don't function properly, we fail to absorb B12. As simple as that. You may take it, but you don't absorb it. Okay, now that you know why hydrochloric acid is so important, what causes it to be low, and what the symptoms are, what can you do about it? Fortunately, most people can correct low stomach acid by eating a balanced diet of wholesome foods and by reducing the daily stress level. Talking about supplements, there are a few that help stimulate the body's own hydrochloric acid and can be taken before meals. The first one is niacin, which is another name for vitamin B3, then magnesium chloride, and finally pyridoxal 5-phosphate, that is the active form of vitamin B6. Then some people find drinking the juice of half a lemon squeezed in water or 1 tablespoon of apple cider vinegar in a glass of warm water 20 to 30 minutes before meals. Rosemary, ginger, cumin and orange peel used to make tea and ingested before meals can also be helpful. Then hydrochloric acid as betaine hydrochloride with pepsin can be added to help digestion. I personally am taking this one with an enzyme blend and find it very helpful along with proper eating habits and mindfulness. However, people should be careful with taking hydrochloride when there is already normal or excessive stomach acid production or gastritis, as it may increase the risk of gastric irritation or ulcer development. Also, taking calcium and magnesium before bed is good with low stomach acid. So let's summarize and maybe add a few more recommendations. Add apple cider vinegar or lemon juice to the diet. Drink it before meals. Reduce or eliminate sugar from the diet as it is mineral depleting. Supplement the diet with hydrochloric acid with pepsin as well as digestive enzyme supplements at each meal. Consume fermented foods, eliminate processed foods, chew your food thoroughly and eat smaller meals. And finally, very important, eat in a calming environment and relax around mealtime. Okay, low stomach acid is one possibility, but there's also the opposite condition that can wreak havoc, and that's too much stomach acid or hyperchlorhydria. What can cause too much acidity in your stomach? H. pylori is a common type of bacteria that grows in the digestive tract and tends to attack the stomach lining. H. pylori infections are responsible for the majority of ulcers in the stomach and small intestine. Then the use of NSAIDs or non-steroidal anti-inflammatory drugs. They are the most prescribed medications for conditions like arthritis. Food type and quality is another important aspect. Think of spicy and greasy foods, also timing of your meals. In this case, leaving too much time between your meals. Then food allergies, particularly to dairy. Alcohol irritates the stomach lining. Talking about dairy again, milk can upset the stomach as it contains both fat and protein. Then caffeine is one culprit. And finally, smoking, which is more than just an irritant. It triggers acid production as it relaxes the sphincter and allows stomach acid to travel up, causing acid reflux. So smoking really is a double whammy. One of the main issues with too much stomach acid is that it can lead to ulcers. These are sores or lesions in the lining of the stomach or small intestine. And there are a few factors that contribute to the development of those ulcers. We can again talk about regular use of NSAIDs or long-term use of high-dose steroids with NSAIDs. Moderate to excessive alcohol consumption, heavy smoking, dehydration, food allergies, caffeine again, and nutrient deficiencies. So what are the main symptoms of too much acid? Although low and high stomach acid have quite different outcomes, their initial symptoms are the same: heartburn and indigestion. In case of too much acid, you may also have burning sensation and abdominal pain immediately after eating, nausea, regurgitation or vomiting, loss of appetite, belching, stomach bloating that worsens when you lie down at night, and black tarry stools, which is a sign of GI tract bleeding. So what can you do about it? Now, this will be very unpopular, but avoid coffee, tea, caffeine in general, stimulants, and carbonated beverages. Peppermint is controversial. Even though it is helpful for the digestion, it also relaxes the sphincter between the stomach and the esophagus and therefore can worsen acid reflux if you already experienced that, so it's best to avoid it. Spicy foods won't do good either, as well as sugar, alcohol, and artificial sweeteners. Instead, drink lots of pure water and increase fiber intake. Think whole plant foods like fruits, vegetables, nuts, seeds, grains, and legumes. And needless to say, decrease or even better, eliminate refined carbs. Of course, avoid foods that you know you're sensitive to, and it's especially important to eat those dark leafy greens. Let's say you already have ailments caused by high stomach acid. What can you do to find instant relief? Try drinking a 1/4 teaspoon of baking soda in a glass of water. This acts as antacid when it comes to stomach acidity. Then also calcium and magnesium can balance the stomach acid. So if you have acute or early stress and too much acidity that comes with it, try taking them before meals. Drink up to 4 glasses of pure water. Studies actually show that it can be as effective as over-the-counter antacids for heartburn relief. I need to briefly mention fasting here as well. If you already have an ulcer from too much acidity, then fasting is not something that is recommended for healing that ulcer. However, if your ulcer is under control, then fasting may be beneficial for other conditions you are suffering from. Now is a good time to mention, if you are interested in learning more about fasting, I have a full downloadable guide covering all that you need to know. The fasting hows, whens, whys, precautions, dangers, as well as coming out of the fast. The link will be in the show notes or in the blog post when I manage to get it up. That being said, there are some clinics and fasting practitioners who believe that fasting can treat ulcers. In the first test case of the master cleanser, Stanley Burroughs, one of the first natural healers who published a cleansing protocol in the early 40s, claims that he cured a patient with an intractable ulcer. The interesting fact is that the 2 key ingredients of the master cleanser are citrus and cayenne pepper, substances that all the other physicians had suggested this patient avoid. Burroughs, however, concluded that they might be the only things left to heal the ulcer, and perhaps he was right. The fasting process itself is helpful for ulcers as it reduces stomach acid and aids in tissue healing. Now, even though fasting usually reduces the amount of stomach acid, thinking about food or smelling it make the brain tell the stomach to produce more acid, which can then lead to heartburn. So caution is required here. Coming back to cayenne pepper, although hot, it heals mucous membranes and is actually commonly recommended for ulcers in herbal medicines. So even though peptic ulcers are on the contraindication list when it comes to fasting, many people with inflammation in their digestive tissues may still be helped by it, especially with cabbage juice, greens, and other fresh vegetable juices. Now let's address the obvious controversy here. Given that the symptoms of low and high acidity might mimic one another, how do you then distinguish between those two? Fortunately, there are ways to do it. But before we move forward, I need to share another experience of mine. I wasn't sure myself which was the case, too much or too little acid, as the symptoms were all over the place. So I needed to schedule coloscopy and gastroscopy under general anesthesia. As crazy as it sounds, in Estonia they still do those procedures with patients fully awake. In fact, I went through awake gastroscopy in January, and what can I tell you? Never again. In April, they attempted fully awake coloscopy on me. I didn't know what to expect at that moment. I thought it wasn't going to be as bad as the other procedure, but little did I know that the pain was unbearable and I asked them to stop. So, in order to get those things done under general anesthesia, you need to have an appointment with a gastroenterologist first. There I was sitting in her office and thought I'd ask about the ways to determine whether I have hypo or hyperacidity. What came next truly amazed me. She said that there is no way to determine that. Secondly, she said that it's not even important. Go figure out. Well, that's that. From that moment on, I shut my mouth and concentrated on getting the examination done and then continue working with my functional medicine doctor when the results come in. I'll fill you in on the test I did to determine low or high acidity later on when I've introduced all the options to you. So, first there is Heidelberg capsule gastric pH test, which directly measures stomach pH. However, this is not something you can do at home but need a physician to perform it. The Heidelberg test will accurately verify the presence of low or high stomach acid production, no acid in the stomach, dumping syndrome, it's when your stomach empties too fast after a meal causing diarrhea, nausea and feeling lightheaded or tired. Then gastritis, heavy mucus in the stomach and pyloric insufficiency. Pylorus is another sphincter we have between stomach and the first part of small intestine. Sounds like an awesome test, doesn't it? How is it performed though? It goes so. The patient swallows a small electronic device about the size of a vitamin capsule, which tracks acid levels in the stomach as the patient swallows small amounts of baking soda, which neutralizes the hydrochloric acid in the stomach. For example, if the acid level does not return to normal after the baking soda is swallowed, the patient has hypochlorhydria, that is, too little acid. The capsule is attached to a long thread to control the position of the capsule in the stomach, and there is a transceiver on the patient's stomach during the test. It will take about 1 to 2 hours to perform it. So it's worth finding out whether there's a possibility to undergo this kind of examination in your area. Now moving on to the things that you can do at home. First, baking soda test. You dissolve a 1/4 teaspoon of baking soda in a glass of water, 240 milliliters, and drink it on an empty stomach. Now start timing and record the time it takes to produce the first burp. It should happen in a few minutes, but don't wait more than 5 minutes. If there's enough hydrochloric acid in the stomach, baking soda will react with it and start producing CO2. If there is not enough acid, CO2 will not be produced. As simple as that. For more accurate results, it is recommended though to take this test for 5 consecutive days. Secondly, you can test yourself with betaine hydrochloride supplement. Take it before a meal. If you experience any warmth, burning or indigestion, then it's likely that you have too much acid in your stomach. You can relieve it by drinking 1 teaspoon of baking soda dissolved in a glass of water. And thirdly, when you are having heartburn, take 1 tablespoon of apple cider vinegar in a glass of water. This should supply the valve between the stomach and esophagus with the acidity it needs to function properly. If this works, you need more stomach acid, but if your heartburn becomes worse, there's probably too much hydrochloric acid. Again, you can relieve it with 1 teaspoon of baking soda in a glass of water. So which one did I try? I went for the baking soda test. Let me tell you, I didn't even have a little chicken burp, not even a sensation. So I ordered betaine hydrochloride with pepsin and started to take it with each meal. And I can definitely feel the difference. My digestion is much better and I'm having fewer symptoms day by day. Of course, given that I practice mindful eating and at the same time not overeating, not snacking between meals and chewing properly. Refined food is not something that I need to worry about, as eating those things is ancient history for me anyway. Now, a quick recap on how to figure out whether you have too much or too little acid. First, high-level test, then baking soda. Third, betaine hydrochloride supplement test, and finally, apple cider vinegar with heartburn. To close things up, I would like to summarize the worst and the best things you can do related to stomach acid. Let's start with the worst. Smoking and excess alcohol, obviously. Then too much caffeine and other stimulants. Eating in a hurry while concentrating on something else. Think of eating while scrolling through your social media or working behind the computer, watching TV and whatnot. Then not leaving enough time between meals. Stressing out all the time. Eating refined foods and trans and hydrogenated fats. Having too much liquids during a meal. And eating too much food at once. And now the best things you can do. Sit down with your meal mindfully. Take a deep breath before you start, or a few deep breaths, and be grateful for your nutritious meal. It will get your gastric juices flowing. Drink plenty of pure water, but not cold, by the way, between meals. Eat whole foods as nature has grown them, fruits, vegetables, grains, legumes, nuts and seeds. Practice meditation. Find a practice that works the best for you. It can also be a meditative activity like yoga or forest bathing. And get into the nature every day, and if possible, be barefoot on the ground. Okay, that was a monster episode. I truly enjoyed sharing all that wisdom with you and learning so much in the process myself. I hope you took a lot of useful information with you and can put it into practice in your daily life. I'd appreciate your feedback in the form of ratings or simply send me DMs on Instagram or comment under the show if the platform allows you to. And I can't wait to be back with you with more fascinating topics and dive deep. Take care.